triangles of the axillary region and the spaces, the quadrangular spaces. So this particular triangle that this is the entire picture that I want you to imagine. There's obviously teres minor as the muscle above, teres major as the muscle below. Minors have to be given a specific special opportunity. Minors are always preferred, they are above, majors lower, right, out of respect. That's how we remember teres minors above, teres majors below. The blue muscle is going to be triceps, which is kind of going on to the humerus lower in the distally. It's in very close proximity to the humerus. Now obviously the first triangle that I'm kind of marking in black right now is your upper triangle, and the lower one, which is your lower triangle, right? So you've got two triangles and one quadrangular space, superior triangular space, and the inferior triangular space. Okay, so having said that, let's jump directly into the first space that we have, which was the quadrangular space, right? So the quadrangular space, let's look at it. Okay, so the quadrangular space, when we're looking at it, superiorly we've got the teres minor, as we can say, right? Inferiorly we've got the teres major, as we can say. Again, I had a tick mark there. And laterally what we've got is your surgical neck, and medially you've got your long head of you've got the long head of triceps. Okay, so this is going to be your lateral, this is going to be your medial. All right, so having said that, right, let's look at the content. Okay, now because the quadrangular space is so close to the surgical neck of the humerus somewhere, right, here is the surgical neck of the humerus. I want you to remember which nerve runs very close to the surgical neck, and obviously that's the axillary nerve. So obviously axillary nerve. Okay, and along with axillary nerve, obviously which artery is going to run? Any guesses? Which artery is going to run along with the axillary nerve? Well, obviously it's going to be your posterior circumflex, right? It's going to be your posterior circumflex humeral artery. Because why? Because it's a very close proximity with the humerus. So posterior circumflex humerus artery. Okay, so two contents in the quadrangular spaces. Okay, so I want you to remember two triangular spaces, two content in the quadrangular spaces, okay, and two content in the lower triangular spaces. Okay, so let's look at the lower triangular space. Now the lower triangular space is superiorly bounded by what? It's superiorly bounded by the teres major, as we can see. Okay, medially it has the long head of triceps, laterally again it has the shaft of the humerus, right? So if you're looking at the shaft of the humerus, which nerve is running in close association with the shaft of the humerus? Obviously the radial nerve. We all know about Saturday night palsy, do we not? So yep, so the radial nerve. Okay, and what very important artery runs with the radial nerve? The radial nerve, which kind of runs with the radial nerve? The profunda artery, the profunda brachii, right? The profunda brachii artery runs with the radial nerve. So having said that, so you would have profunda brachii. I'm being very specific about profunda brachii because that's how it is supposed to be written. All right, so it has the profunda brachii artery. Okay, so again, two contents of the lower triangle also done: the radial nerve, the profunda brachii artery. Okay, last, the upper triangle that we have left. The upper triangle, how is it? The upper triangle has your superiorly it has a teres minor, inferiorly it has the teres major, but laterally it has the long head of triceps. How? Because this becomes the lateral part for the triangle, right? So laterally it has the long head of triceps, and because I have here what I have marked, I did not explain initially, is actually your scapula. Okay, because obviously the teres major and minor are going to attach to the scapula. So there is an artery that runs there because it's a close association with the scapula. And which artery is in close association with scapula? Any guesses? It is going to be your circumflex scapular artery. So that is covered as well. The one that runs in close association with the surgical neck in the quadrangular space is axillary nerve. The one which runs with the axillary nerve is posterior circumflex humeral artery. That has to be learned. The one that runs in close association with the shaft of the humerus is going to be your radial nerve. The one that runs with radial nerve is your profunda brachii artery, and because your scapula is here, the circumflex scapular artery is in very close association with the scapula. Now let's have a look at the table and let's just tick what we've studied. Quadrangular space studied, teres minor above, teres major below. Yep. Surgical neck as lateral, medial is long head of triceps. Axillary nerve because it is with the surgical neck, and posterior circumflex humeral artery, very important. Obviously, common side of axillary nerve injury and paralysis of deltoid and loss of sensation over regimental badge area, very important. All right, the quadrangular space has been covered. The upper triangular space is again, oh my god, what did that happen? Oh, sorry, some glitch probably. Okay, the circumflex humeral scapular artery forms a part of the scapula anastomosis, as we've already understood, and the lower triangular space is a part of the superior teres major. Superiorly, it has teres major, and as we had already studied, but what was important is radial nerve was there and a profunda brachii artery. Again, it is the site of Saturday night palsy, right? Saturday night palsy and radial nerve entrapment. So that is about it. Sorry for the glitch, and I mean it's quite the diagram itself is really well explained. We do not need that table, but yet for all practical purposes that table was kind of introduced. And thank you so much, and see you in the next video.